Welcome to another episode of Victoria's Lounge from the Radisson Blu Hotel. I'm wearing my purple, or at least a hue of purple, and that is to commemorate Lupus Awareness Month this month. And we're talking about a condition that many of you might know by name, but do you really know the details of what it's like? We're talking to three brave, beautiful, extraordinary women who are living with the condition and want to raise more awareness and inform you and educate you on what it actually means to live with lupus. We also have a doctor on set. Let's meet them now. Mwari Mudaura is a clinical psychologist and entrepreneur who has been living with lupus for about 14 years. She was diagnosed while in her second year of university after years of being frequently sick and misdiagnosis after misdiagnosis. Natasha Muloko is a student who was diagnosed with lupus back in the year 2000. Lupus attacked her kidneys in 2011, after which she went through her first transplant. But 6 months later, it failed. And ever since, she's been on dialysis. Yet, she has hope she'll soon get a transplant and live a normal life. Dr. Philip Simani is a rheumatologist in private practice with a background and broad experience in medicine and rheumatology. His passion and interest to see health delivery to the grassroots has seen him work with UNICEF in South Sudan and in Seattle, Washington. Lona Irungu Masharia is a communication strategist and was first diagnosed with lupus in September 1997 after struggling with her health for more than 7 years without having an accurate diagnosis. She has had 3 kidney transplants and has purposed to live a happy, full life to show that lupus diagnosis and even kidney failure and transplantation isn't the end of one's life. Remember, hashtag Victoria's Lounge is how you can chime into the conversation on social media. I have the ladies in purple, or at least some hue of the purple family. Doc, you didn't wear a purple tie or something to raise awareness. Of course, we're wearing purple because it is Lupus Awareness Month. Speaking of which, Dr. Simani, if you could just give us a brief explanation of what lupus actually is.
Lupus is a complex multi-system autoimmune disorder that's characterized by widespread inflammation throughout the body, which can affect any organ.
Okay.
What that means is that the body's immune system is then directed inwards against itself, as opposed to being directed outwards towards bacteria or viruses or other substances that may endanger the body.
Wow.
It tends to be a disease that affects women more than men, particularly women in the childbearing ages of, say, between 15 and 45, in a ratio of about 10 to 1.
Wow.
Outside those particular age groups, the ratio narrows down a bit, and that's towards menopause or under the age of 15.
Okay. So women, and I read somewhere primarily women of color are more at risk for lupus.
It tends to be more common and more severe amongst people of color.
Okay.
Yes.
Okay. And Lorna, you practically are the poster child.
Sadly so.
Of lupus here in Kenya. But you have raised so much important awareness of the condition. Take us through your journey and how you got to the point of being diagnosed and knowing just what it was.
So he's been rightfully said between the ages of 15 and 40. First symptoms showed up when I was 15. So I was in high school when the first symptoms came up, and we discovered that later. Of course, at the time, we didn't know it was lupus. There was inflammation, swelling, unknown fever, like no cause. And that was when the symptoms first occurred. But in later, probably about 6-7 years later, and I was about 21, then it got really a lot more unknown. So I just have a lot of inflammation. I'd have a lot of swollen glands. I'd have a lot of fevers. And whenever they did tests, nothing conclusive. In fact, the initial assessment was I had juvenile arthritis or juvenile rheumatism. And so it's because my joints were swollen and they were hot. And it got really, really severe about maybe 20 years ago. And at that point, in fact, the reason that I ended up understanding what the diagnosis was at this time, my hair was falling off, and I had a very distinctive rash associated with lupus, which was right around my T-zone, really flaky, dry skin. I had lost a lot of weight, and I was just in a lot of joint pain. And it wasn't until my kidney function got compromised that I was diagnosed, and that was in 1997.
Wow.
And at that point, part of the diagnosis was I also went to the US at the time, and I had, luckily at the time, I worked at KTN, and just before I went to the US, there was a colleague of ours in the office who was always really tired and could skip work, and I never understood. And one day she said, I have lupus. And I was like, lupus? And she says, yeah. And I think you do too. And I was like, really?
Wow.
And I was like, okay. And so we talked about it, and she gave me a nurse's manual on lupus. So that was my first time hearing the disease,
interaction
with the disease. And then talking to my doctor at the time, and him saying, I think that's what you could have. And he's like, but I've never met a patient with it. I've read it. And so he did a battery of tests at the time, about 14 different tests, and said, I think you do have lupus. And then at this point now, it was trying to figure out what was happening with my kidneys. And unfortunately, by that time, it was too far gone. My kidneys were in end-stage kidney failure, and that, as I say, was the end of that. And that's how I ended up having kidney failure.
Right. And you had to go through a kidney transplant.
Yes, and then the process went through dialysis. Got my first transplant pretty quick from diagnosis to actual transplant, because I was in end-stage kidney failure and hospitalized by October. And I had my first kidney transplant in January of 98. And that was the beginning of that journey. And I've subsequently had 2 other transplants in the course of the last 19 years.
My goodness. And of course, we'll talk about now you living with it, treatment and everything. But let me come to you, Mari, and how you found out as well. When did you first see that there's something up that's not quite right?
I just was always sick since I was a child. I had tonsillitis, throat infections, joint pain, rheumatoid arthritis, stomach problems. And then it really got bad in high school. But I didn't really get treated because it was a case of not being believed, actually. Because I didn't really look sick, but I was always complaining. And then when I was in college, in my second year, I got very sick. I'd get sick being out in the sun, and then I got the rash.
The sun, would it aggravate
the
condition that much more?
Yes, like I'd be out basking in the sun, and then I'd get sick. Or, you know, after a hike. And then I was always tired. So I had been treated for many things, including acne because of the rash, which, you know, the treatment sort of scarred my face for a while there. And then I went to the university's medical faculty, and the lady at the reception just told me to talk to 2 doctors there, and then that was the beginning. So they did tests for a long while, and then I started on the treatment. Yes, in my second year.
Amazing. So did you have to also go through any sort of kidney transplant or any other procedure?
No.
I
have. I've just been on pills and drips and injections.
And that's the thing, it manifests differently with different people. For you, Natasha, what was your experience like? Because you're currently on dialysis.
When in high school, the only time I was sick was the inflammation of my knee. But it didn't take, but in the morning I was better. So when I reached 18, even as a family, we were going through so much. I think that's what triggered it, because I became sick. Unfortunately, I was in Tanzania, and they diagnosed malaria. So they gave me malaria, and I was getting worse and worse for 2 weeks. And you know, malaria only take for 1 week. 2 weeks later, I was still sick. I went back to the doctor. He's like, oh, the malaria is hidden behind your liver. Surely, I don't even think that's a correct diagnosis. So my mom was like, let's just go to Nairobi. We came to Nairobi. The first doctor I saw, I remember, he was like, he told my auntie, why are you bringing this girl here? She has leukemia. Look at her hands. I broke down. I cried. I was so devastated. So we went straight to the hospital, the main hospital. and they did tests for 3 weeks. It was only a point where one of my relatives came to hospital, and she was like, she asked the doctor, have you checked her for lupus? I didn't know that my auntie's daughter, my cousin, had lupus. So my auntie's one was like, have you checked her for lupus? So the doctor's one was able to do the lupus. And at that point, I remember no lupus test was done in Kenya. They had to send it to some other country outside Kenya.
Wow.
So they did it took like 2 weeks. I stayed in hospital for 3 weeks. That's when the diagnosis came. The first thing I remember they did was inject me a fat, it was like this, I don't know, it was so fat.
Yeah.
And it was long and fat. I was so traumatized. They injected me. The next day when I woke up, I was swollen, puffy, but I was discharged. Like the moment I was so relieved, because sitting in hospital, every day there's something new.
Exactly.
They treat it, it goes, something else comes back the next day. It was so much on me. I was young, I was 18.
Right.
Both my parents were not in the country, they were working elsewhere. So it was a lot for me. So when they told me, you have lupus, it was a relief for me.
You actually know how to fight this thing now. Yeah, yeah.
So I didn't even break down or anything. I was so happy. But the mistake I remember I did, I saw a nurse's book and I took it and I read the definition of lupus. That I was like, what is this? Yeah, so slowly by slowly, and my friends found out. They told me even Lona Irungu has. So I started reading, and that's how I came to accept and love lupus, because that's the only way.
Yeah, I mean, and considering that we were talking earlier, Natasha, and you said life was normal for you.
Yeah.
You were very active,
Yeah.
and then all of a sudden the diagnosis comes.
Yeah.
You know, and Doc, that seems to be the case where some people, you know, Mari says, I was sick most of my life, and then I found out it was this. Is there a known cause, or can it just crop up?
The vast majority of patients who have lupus have what we call idiopathic lupus. That is, we don't know what the cause is. But there is a small proportion of patients with lupus that have what we call drug-induced lupus. This is a form of lupus where a patient may ingest drugs and several weeks to several months, sometimes several years afterwards, they start developing features suggestive of lupus. But that sort of lupus, drug-induced lupus, is a distinct entity that is different from the idiopathic lupus.
So what kind of
we
drugs
really
would
don't
kind
have
of trigger the
well,
drug-induced?
the hypertensive drugs. There's a drug called hydralazine, which was first noticed to cause symptoms of lupus way back in 1953.
Wow.
And the decade that followed, they examined other drugs that are used for treating hypertension, and some of them were found to also cause symptoms of lupus.
Wow.
There are also heart drugs like procainamide.
Right.
Some of the drugs used to treat tuberculosis, like isoniazid. Some of the drugs that are used for convulsions may also be involved. So what happens is the individual ingests the drug, and again, several weeks to several months, they get the symptoms.
Right. So over a course of time is when it will start to kind of manifest.
It manifests.
Okay.
And when you stop using that particular drug,
Yeah.
then the symptoms disappear and go away. So that's a form of lupus where we know the cause.
Right, right.
And you know, we can control it. But the vast majority of patients have an idiopathic form of lupus where we don't know the cause.
Wow.
But we do know triggering factors.
Okay.
There are different triggering factors. Each individual will probably say, I had a flu and a cold, and then all this began.
Okay, okay.
Or I was out in the sun, and whenever I went out in the sun, I'd get these rashes. So there are triggering factors like ultraviolet radiation, infections may cause, and yeah.
Wow, wow. And the conversation definitely continues. For those who had no idea what this condition is all about, keep watching. Let's take a short break here on Victoria's Lounge. We'll be right back. Welcome back. You're watching Victoria's Lounge. I hope you're keeping the conversation going on social media. Now, Lorna, you know this world all too well.
Yes.
And living with lupus in the public eye, what was that like?
When I got diagnosed and when I got sick, I was already working in television. So it wasn't something I could hide. I was a presenter on TV. So one day you're there, one day you're not. You have to give an explanation. You know what happened. And so I never set out on this journey to be this face of this, okay? Part of it was my friend who I mentioned to you passed away. Yeah. She passed away from lupus-related complications. In the 90s, there was very little information available even within the community. And so one of the things we struggled with was to get information. I was very lucky. I had a sister in the States. I had family abroad. I could get that information. So my initial speaking out about my condition was so that if there was other people, because then, as he has rightly mentioned, it's that age group. I had the same experience she had, where no one believes you.
Right.
You know, I would be fine.
Don't look.
Yes.
Yeah.
No, I would be fine one day, and then in 2 hours I'd go from having a good time to being in excruciating pain.
Wow.
So if my mother, and I remember my mother having a conversation once with the doctor and saying, do you know how much she enjoys life? There's no way she's pretending. Yeah. There's no way she'd want to be at home. Right. So why I spoke up was so that you could, if there was somebody who was being told you're having hysterics or you're just being, irritating, or no, you don't have symptoms, it's in your head, which I was told, which my mother was told, that they would know that they're not crazy. Right. Okay? When I continued to share what it was like, I think once you get into a space and you discover things. So when my lupus caused kidney failure, when I got into the space of looking for a donor and starting to talk to people and understand what kidney failure means, you start hearing these horror stories of people who had said, well, I know an experience of somebody who said their relatives wouldn't give them a kidney unless they paid for it. I was like, what are you talking about? So suddenly, and then understanding that it's because people were like, so what if I give my kidney, what happens to my life? So it's not necessarily from a bad point, it's just from a point of lack of information and awareness. Yeah. So there was that side. Yeah. The flip side of it is you become a single story. So everyone who saw me was like, aren't you sick? Aren't you sick? Aren't you sick? And on some point, that information comes back to you, and what it says to you is you have no future because you're sick. Yeah. It's hard enough dealing with a diagnosis that doesn't necessarily always have positive results, and looking at the statistics. And then you have to make a choice and ask, am I going to live my life according to the statistics, or am I just going to choose to live my life? I have been denied work because I've had people say, well, we're not sure we can depend on her because she's sick. Initially, at some point I was told, you have maybe 5 good years, you'll be fine. Now, you can't do anything necessarily individually, but you have to figure out what it is you're willing to take. And one of my pullbacks from being very visible in the public eye was because I did not want to have this conversation anymore. I wanted to live my life because this is the only life I know. My life has lupus in it, but it's a life I know. However, it's a condition I live with. It is not who I am. I like that. Yeah. Okay? Yeah. And that, for me, was the key thing. And speaking up and sharing was really about letting people know that this is out there, and hoping that no one has to walk the path I did. And it's sad to hear someone saying that being diagnosed literally 10 years post my diagnosis, that you still had to go through some of the same challenges, because part of the thing that you want to do is ensure that you've spoken about this, that people at the back of their minds will look at it. I have a doctor who always says, if you come in with X number of symptoms, I automatically test for lupus. You're a woman of color, you're in the right age group, boom. And this is a GP, so before you kind of go to a specialist. So that for me, I think was a whole reason. And it's not easy because people almost decide what you should do and what you shouldn't do. When they see you somewhere, they're like, why are you here? Why are you enjoying life? What are you doing? And that's not the situation. I'm just being me, unfortunately. So he was very right. Some people, it affects your liver. A friend of mine, it affected her skin. Somebody else, it affects the nervous system. So lupus is complex and it manifests in different ways.
And speaking of which, Dr. Let me bring you in on this, because Lorna just said it's very complex, very hard to understand. And now when it comes to sensitizing the medical fraternity on this and how to look out for signs, because we've heard from Natasha and Maury about how you go in and out with different diagnoses. You're given different medications. It's never what you need exactly. So how are we ensuring that there are enough specialists, one, and that general practitioners, physicians, actually can see some signs to direct them in the right direction?
One of the big challenges is the cost of some of the laboratory facilities.
Yeah.
Initially, I'm sure she'll attest to that, samples had to be sent abroad initially because it couldn't be done here.
Right.
Even though it can be done here, a lot of the tests are done locally. They are very costly, and many Kenyans do not have access to those laboratory facilities. So even if a doctor in a remote county suspects that this individual has lupus, where do you go from there if the facilities to make a diagnosis are not available? So I think that one has to speak to some of those challenges.
And you're one of a few rheumatologists in the country. How many are there now? And what would you say in terms of the scale? How many do we need to be able to deal with lupus?
I think we're about 5, but we probably need at least 10 times that.
And that's 5 has come after
that
how long?
number. So I think progress is being made. Part of the reason, I think, is because when you look at causes of infant mortality and morbidity, rheumatic diseases are not up there as causes of mortality. So when you prioritize health expenditure, then you want to focus on the big killers, HIV and malaria, other tropical diseases. So you find that rheumatology loses out in that.
And Mari, do you feel or find that you're that much more isolated with your condition, especially when it comes to getting the attention you need from a doctor, from a hospital, for instance?
Right now, no, because it's been a long journey, and I have a good doctor, and I have good support systems. I know what to do, what not to do. I have found a community of people who are sick, both here and abroad, and we talk to each other, so it helps to know you're not alone, and it helps to have someone else validate what you're feeling. But when you go to the ER, for example, on a very bad night, or randomly because your doctor is not around, you often find yourself trying to explain yourself to the nurses and the doctors, because they want to do their thing, yet you know what's going on. It's a flare.
Take us through, actually explain what that's like for someone who has no idea what a flare-up is, for instance.
Okay, it's different things for different people, or sometimes it's different things for me. Migraines, you're dizzy, you're tired, you're in a lot of pain, sometimes you're throwing up, sometimes, you've passed out in the shower because something happened and you don't know. Sometimes it's seizures, some fevers, especially fevers, and sometimes you get infections just from hanging out with people. And too much fatigue. It's like having this painful tiredness. I don't know how to explain it.
So aches and pains
yes, but it's painful, but it's tired.
That's actually the word. Painful tiredness.
Hair falling off.
You're right.
Your eyes hurting.
So even when it comes to treatment, because you said you're on medication, what does that entail in terms of how often must you take it, how much?
There's some medicines that you have to take every day. So it's a combination of steroids, there's an anti-malarial, and then if you have, there's some diseases that sort of come along with lupus, and I think I have about 12, and I have to manage those also. So I have to keep taking the drugs for that as well. So on a good day, I'm probably swallowing maybe 60 pills in total. And that's including supplements and medicines from other doctors who are not my primary physician for the other things.
It's interesting. You just kind of explained your routine, Mari, of what you have to go through medication-wise and everything. For you, Natasha, dialysis is a big part of your life now. How have you managed to get through and create some form of normalcy in your life?
With lupus, if you're stressed because you're doing dialysis, you increase the effects of lupus. So you have to find that calm place. For me, I said finding what has lupus done to me positively. One, I've become a patient person. I was a very rough, all over the place. You tell me something and I'm against it and I won't listen. But lupus just, I don't know how, it just calmed me down. It made me learn to listen to people, accept. When I see someone on the street in pain or a beg, you know, you feel them. You get empathy. You learn how to empathize with people. So that's how I learned. I just realized that the only way to beat lupus is to be positive and to smile and to laugh and to accept.
Yeah, I mean, and it's really a mind game when you think about it. Perception, like you said, Lorna, it's also not allowing other people to hijack your story.
When you're in a space of active disease, you absolutely have to prioritize. You have to decide, this is my priority. My priority is to get through the day. My priority is to be happy. My priority is to stay positive, right? You can't allow people to hijack that for you. So it's also the people around you, probably just kind of being on the lookout and being like, are you taking care of yourself enough? Are you watching the signs of your body? Are you just aware of what's happening?
Right. And you're right, you have to understand, and I guess this makes you even more heightenedly aware of yourself and your health. On that note, let's take a short break here in Victoria's Lounge. When we come back, we'll be talking about the lifestyle changes and raising awareness on lupus. We'll be right back. Welcome back. You're watching Victoria's Lounge. During the break, we were talking about how complicated and complex this condition can get. Lorna, you said earlier that working out has helped.
Yes.
What more have you done to kind of really manage?
Because of inflammation and fatigue, movement does ease the symptoms, but not. So I don't run, I don't pound pavements. It was swimming. I initially swam a lot of yoga. And then because of the steroids, which part of the side effects is sipping out the calcium and weakening your bones and weakening things like that, I got into weight training at some point. So now I'm not trying to lift more particular weights, but what does resistance training look like? Steams help with the pain. Like after a workout, you're really, really sore, so doing that. I have a physiotherapy and a chiropractor to work with. So there's a team for me that I work with who all know what my symptoms are. At some point, I had TB of my spine. I had a fracture in my spine, so I also have a trauma specialist.
Wow.
So I have a medical team, which I'm sure everyone here does in terms of multi-organ thing. And it's agreeing one who's a team leader. And at this point, I'm the team leader because it's my body and I'm the one who knows what I'm going through. And sharing information. I can't take supplements because I'm a transplant patient and part of it is to keep my immunity low, so I can't boost it. So any nutritional thing has got to be approved by a doctor. I don't do fads and diets, as wonderful people want to do. Weight management is a key thing in trying to do all this.
And Dr. Ari, for a lot of women who have lupus, there is concern about pregnancy.
Yes.
What are the complications, or what is the case for a woman who, say, wants to get pregnant?
Today, it should be possible for a woman with lupus to have a normal pregnancy. But then patients with lupus are at risk, and they're at risk because of certain special problems. We have a syndrome known as the antiphospholipid syndrome, which unfortunately may lead to miscarriage amongst some women. And also, just the lupus disease itself has a tendency to lead to miscarriages. So you may find, especially in the third and fourth month. So that may lead to a lot of frustration for women who want to start a family. And otherwise, as long as a woman is under control and you can control the inflammation, she stands a very good chance of conceiving and having a normal delivery.
Right. Yes. And because you have to consider that she's also on medication. What kind of impact does this have on the pregnancy?
It can have a really big impact. There are certain drugs that we tend to avoid, that we recommend she avoids. during pregnancy. There are other drugs which, if it were possible, we would avoid, but more often than not, we tend to use them.
And speaking of which, Mari, you said you had studied this in terms of what it can mean impact-wise on children. As a clinical psychologist, what did you find?
Just a lot of kids with developmental disorders.
Yeah.
Some of the mothers had been on a lot of steroids or other medications. However, some of them were abusing them. So, but there is a risk factor there.
Right.
So,
right.
I think it helps to be careful.
Right.
Right. And talk to the doctor before getting there.
Yeah, absolutely. Yeah.
Mm-hmm.
And being deliberate.
Yes.
Speaking of being deliberate, lifestyle changes for you.
So I have eliminated some of the things that a lot of people will put in their food. So my diet is strictly clean, no processed food. But I also try and exercise. I don't do any heavy stuff, but I jog and I walk, and I do light workouts. But I also seek counseling when things are thick, because it helps to just know what's going on.
Yeah.
And I think lupus is really a life of loss, because there are a lot of things going on. You know, you can't go hiking whenever you want to. I used to go hiking all the time. I was always, you know, singing in the concerts, and then I can't do that anymore. Or there's so much going on that you lose along the way, and it helps to process that and be very aware of what's going on. So I think mental well-being is a big thing for me.
Yeah. And I mean, just like Mari said, Natasha, it's a life of loss. Let's talk about the money aspect, because you are, of course, on dialysis. How much does that run you about a month, for instance?
Roughly 100,000.
Wow.
I would say roughly, because you have to put in the tests, the blood tests you do every month. You have to put in the medication, because like there's a drug we take called Celcept. Majority of the lupus take it, and it's 320 shillings a tablet.
Wow. And
that's in a day. Some lupus take it twice a day. So you see, in a day that's 650, roughly there. So there's also that. There's consultation, Dr. Simani. Consult, because you have to see the doctor before he writes for you the test, and after the tests are out. So roughly 100,000. Financially, it's hard.
And then, you know, Lorna, let's talk about something that's really important. You wouldn't think it is that much of an issue, but it is stigma. And just how you managed it, and maybe some advice for other lupus patients.
I think she said it very well. She talked about mental health.
Yeah.
I'm really proud of the fact that right now people speak a lot about the importance of mental health. It wasn't something we were speaking about 20, 15 years ago. And it affected me. It affected me because I almost fell into the trap where I believed what people said about my life, not what I wanted. Lupus is a disease about loss, and I like that. And I remember talking to a psychologist once, told me, you need to mourn the dreams that you have lost by going through this experience. And then you need to decide what it is that you're going to do. But she used a beautiful word. She said there's beauty in it. And the thing is, for me, what's the collateral beauty in all of this madness? My family got closer together. I met somebody who met me when I was sick, and so beyond my sickness. And I got married. I've adopted a child. I have a family. These were not things I thought were possible when my disease was active and I was really ill at the age of 21.
Wow.
But now I am. And so I think part of the stigma is to say to people, and this is my message to lupus patients, or frankly to anyone who's dealing with a chronic illness, you are not your illness. And your illness is a part of what you have to live with. And that for me is the most important thing.
Wow, amazing. That is all the time we have, ladies. Daktari, thank you so much for coming in. And I hope we continue keeping this conversation going. It's interesting, Mari, you have the butterfly earrings. You can explain why you use the butterfly.
So the butterfly is a symbol of one of transformation, because your life transforms, and from all the research that I read, that's what it said. I know the doctors call the rush, when you get it here, they call it the wolf rush. And part of lupus in Latin means wolf.
My goodness. Wow.
It actually means wolf, right?
Wow. Wow.
But also that rush sometimes looks like a butterfly. And that is it. I wear a butterfly symbol also on my bracelet to remind me.
Beautiful. Wow.
So I think butterflies for us, it's also about the transformation.
Yeah.
It's living this life you had
Yeah.
and getting this on. But I want to give you something. This is from the Lupus Foundation of Kenya, and it says, someone I know has lupus. And I think now you know at least 3 of us.
Thank you so much.
So you need to wear that for the next
Proudly.
week.
For the month of May.
For the month of May.
It is Lupus Awareness Month, and exactly why we're having this conversation.
Yeah.
Thank you so much,
You're
ladies.
very
Thank you so
welcome.
much, Dr. for this. It is so necessary just to keep it going so more people know about it. And if you do have it, it's not the end of your life. You've heard from these wonderful, beautiful women that your life still continues and you dictate where it goes. Thanks for watching. Keep the conversation going. It is Lupus Awareness Month. Don your purple. If it's a tie, Dr. forgot his. If it's a shirt, if it's a dress, whatever it is, just to raise awareness and get people talking, to keep them talking. Thanks for watching. Thank you to the Radisson Blu Hotel for hosting us. It has been wonderful having you, and keep the conversation going on social media. Have a wonderful evening, and let's do this again next week. Some hue of the purple family. Doc, you didn't. Welcome to another episode of Victoria's Lounge.
Yes, I got out of date in 20. My boyfriend who then became my debt free for 4 years.